Hello and welcome to Health University. Today, I'm going to talk about liver cancer, a serious and potentially life-threatening disease that affects millions of people around the world. Liver cancer is the sixth most common cancer and the third leading cause of cancer death globally. In this video, I will tell you about some of the signs and symptoms of liver cancer, as well as the causes, risk factors, and prevention methods. If you have one of these signs, you could have liver cancer. Before we get started, can you do us a favor? Please make sure to watch this video till the end and don't forget to subscribe and hit the bell icon for more videos like this. One of the most common types of liver cancer is hepatocellular carcinoma, HCC, which begins in the main type of liver cell called hepatocyte. Another type of liver cancer is intrahepatic cholangiocarcinoma, IHC, which begins in the bile ducts inside the liver. Both types of liver cancer have similar causes, risk factors, symptoms, and treatments. The signs and symptoms of liver cancer may not appear until the disease is in an advanced stage, which makes it harder to treat and cure. However, some of the possible signs and symptoms of liver cancer include: the first sign of liver cancer is weight loss without trying. This could be a sign of liver cancer because the cancer cells use up the body's energy and nutrients, leaving less for the normal cells. Also, the liver may not be able to process food properly, leading to malnutrition and weight loss. The second sign of liver cancer is loss of appetite or feeling very full after a small meal. This could be a sign of liver cancer because the tumor may press on the stomach or the intestines, making you feel full or nauseous. Also, the liver may not produce enough bile, which helps digest fats, causing you to lose your appetite. The third sign of liver cancer is upper abdominal pain. This could be a sign of liver cancer because the tumor may stretch or damage the liver capsule, which is a thin layer of tissue that covers the liver. The pain may be dull or sharp and may spread to the right shoulder or back. The fourth sign of liver cancer is nausea and vomiting. This could be a sign of liver cancer because the tumor may block the bile ducts or the blood flow to the liver, causing a buildup of toxins or pressure in the liver. Also, the liver may not be able to filter out the waste products from the blood, causing them to accumulate in the body and trigger nausea and vomiting. The fifth sign of liver cancer is general weakness and fatigue. This can be a sign of liver cancer because the cancer cells use up the body's oxygen and nutrients, leaving less for the normal cells. Also, the liver may not be able to make enough blood cells, which carry oxygen and nutrients throughout the body, causing anemia and fatigue. The sixth sign of liver cancer is abdominal swelling. This could be a sign of liver cancer because the tumor may block the blood flow to the liver, causing fluid to build up in the abdomen. This condition is called ascites, and it can make the abdomen look swollen and feel tight or heavy. The seventh sign of liver cancer is yellow discoloration of your skin and the whites of your eyes, jaundice. This could be a sign of liver cancer because the tumor may block the bile ducts, preventing the bile from reaching the intestines. Bile is a yellow-green fluid that helps digest fats and remove waste products from the body. When bile accumulates in the blood, it causes the skin and the eyes to turn yellow. The eighth sign of liver cancer, white chalky stools. This can be a sign of liver cancer because the tumor may block the bile ducts, preventing the bile from reaching the intestines. Bile gives the stools their normal brown color. When bile is absent, the stools become pale, clay-colored, or white. If you notice any of these signs and symptoms, you should see your doctor as soon as possible for a proper diagnosis and treatment. Your doctor may perform some tests to check your liver function, such as blood tests, ultrasound, CT scan, MRI, or liver biopsy. The exact cause of liver cancer is not known, but it is believed that it occurs when mutations happen in the DNA of the liver cells, causing them to grow out of control and form tumors. However, there are some factors that can increase your risk of developing liver cancer, such as: Number 1. Chronic infection with hepatitis B virus, HBV, or hepatitis C virus, HCV, which can cause inflammation and scarring of the liver. Number 2. Cirrhosis, which is a condition where healthy liver tissue is replaced by scar tissue, affecting the liver function. Number 3. Heavy alcohol use, which can damage the liver and cause cirrhosis. Number 4. Obesity, diabetes, and nonalcoholic fatty liver disease, which can cause fat accumulation and inflammation in the liver. Number 5. Exposure to aflatoxins, which are toxins produced by certain fungi that can contaminate some foods, such as peanuts, corn, and grains. Number 6. family history of liver cancer or inherited liver diseases, such as hemochromatosis, Wilson's disease, or alpha-1 antitrypsin deficiency. The best way to prevent liver cancer is to reduce or avoid the risk factors that can damage your liver. Some of the prevention methods include 1. Reducing or avoiding alcohol consumption. 2. Maintaining a healthy weight and eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. 3. Getting vaccinated against hepatitis B and taking measures to prevent hepatitis C, such as using condoms, avoiding sharing needles, and getting tested regularly. 4. Avoiding exposure to aflatoxins by storing food properly and discarding moldy food. 5. Getting regular checkups and screening tests if you have a high risk of liver cancer, such as having chronic hepatitis infection, cirrhosis, or family history of liver cancer. Liver cancer is a serious disease that can have a significant impact on your quality of life and survival. However, by being aware of the signs and symptoms, the causes and risk factors, and the prevention methods, you can take steps to protect your liver health and reduce your chances of developing liver cancer. I hope you found this video informative and helpful. If you did, please give it a thumbs up and share it with your friends and family. And if you have any questions or comments, please leave them below. Thank you for watching, and I'll see you in the next video.